Britain's Prime Minister has announced a nationwide lockdown to fight the coronavirus. Boris Johnson told the British people that the government was shutting down non-essential shops and services and banning gatherings of more than 2 people. Johnson's government has faced criticism for its perceived failure to act quickly to halt the spread of the virus.
It's images like these which make it clear how quickly action is needed in the UK. Mobile phone footage of people crammed into the London Underground on Monday after train services were cut to deter people from using them. Experts warn policy must change.
And we can't control how virulent the virus is. We can control the rate in the population, and that's what we should be doing, whether that's by legislation or enforcement or otherwise, because at the moment it's not working.
The British Prime Minister has faced criticism that his wait-and-see policies were dangerous. Now he's decided to follow the lead set by European countries and order a lockdown.
We will immediately close all shops selling non-essential goods, including clothing and electronic stores, and other premises, including libraries, playgrounds and outdoor gyms and places of worship. We'll stop all gatherings of more than 2 people in public.
A major focus of the response to the outbreak, Britain's overstretched National Health Service, the NHS. Here, volunteers bring free food for nurses at the front line of the pandemic. Johnson says the whole country should act in solidarity with the medical professionals.
Each and every one of us is now obliged to join together to halt the spread of this disease, to protect our NHS and to save many, many thousands of lives.
The government is also moving to get supplies of protective gear to staff treating coronavirus patients. The army will be brought in to take gloves, masks and overalls to where they're needed. It's happening later in Britain than elsewhere, but the threat of the virus is emptying streets in the capital, London. The UK, like its neighbours, is digging in for the fight.
Well, for the very latest on what's happening in the UK, let's bring in DW's Birgit Maas, who's standing by for us in London. Birgit, the UK was deliberately slow in implementing a nationwide lockdown. What prompted the government to act now?
Well, the government has been, in the last days, really quite drastically ramping up the measures. Like you said, it's a bit of a U-turn. The UK is behind other European countries when it comes to the outbreak. It's estimated about 2 weeks behind Italy. So the criticism was that the UK could have stepped in with more drastic measures much earlier, learning from other European countries, seeing how the outbreak looks there and just sort of nipping it in the bud in a way. But that hasn't happened. So this is what the focus on what the criticism on the Prime Minister, on the government has focused on. However, now since there was this U-turn and there was the realization that if this continues in the UK, if the trajectory continues and there are no stricter measures, then the health system will simply be overwhelmed. Since then, the measures have been coming quite fast. So now the latest one after the weekend where it was sunny and a lot of people were still out and about and a lot of them also not adhering to the social distancing measures, really crowding together. I think this is what prompted the government now to to go to the most drastic measures so far and be on a par with Europe, the rest of Europe.
OK, so the government has put the UK in lockdown now, but the World Health Organization is also asking countries to step up testing and contact tracing. Is the UK doing that as well?
Well, of course, the UK has been doing it, but again, it's a problem. I think as in other European countries, there's not enough testing equipment. There has been a particular focus, for example, on the protection of doctors and nurses, that they weren't even able to test when they felt that they had a bit of a cold. They weren't able to find out whether this was coronavirus and they had to self-isolate or whether they could continue just with a slight cold to continue to see patients. Another criticism is that there wasn't or still isn't enough protective equipment for doctors and nurses at the front line. They have to improvise with plastic aprons and surgical masks, and still the equipment is not there where it's needed, which is in the hospitals where doctors are seeing coronavirus patients on a daily basis.
Birgit, thank you very much for bringing us up to date. That was DW's Birgit Maas in London.